Um, so thanks everybody for being in here. It's great to. It's always great to these study club meetings because I get to see recent faces and faces I hadn't seen in a while. I hadn't talked to Bernie in probably over a year. So it's good to see you. And Bahar, great to see you. We're really excited tonight. When I first met Dr. Liao, it was in 2018, and he was speaking for Vivos here in Dallas, and I went and heard him, and I knew in the first hour or so that I wanted to become an airway dentist, and more than just an airway dentist, but just a dentist that treats the mouth as like the conduit for health. And teeth are part of that, but they're actually the last thing that we look at. And Dr. Liao is I was just telling him earlier that there are two dental lectures that I could just listen to forever, and he's one of them. And the other one is not myself. It's actually Dr. Ben Moralia. He's a great guy, but I always learn something from Dr. Liao. And if I read his whole CV, it would take half of the time tonight. And I don't want to take any more time away from Dr. Liao than I already have. So, Dr. Liao, I'm just going to let your talk tonight speak for your significance and your relevance to whole health and what the people on this call are really wanting to strive for. And I want to, from the bottom of my heart, thank you so much for being here. And sure. I can't believe I'm going to get to see you tonight and then again next weekend for Tuesday.
Yeah. So do you want to say a word about next weekend?
Yeah, next weekend, Dr. Liao is going to be doing a 2-day course. He'll tell you a little bit more about it, but it's going to be at the Stewart Center. And it's going to be 2 really, really special days. And during that time, you'll learn a lot. Tonight will be just a great, great preview of that. You'll learn a lot tonight too. But we're going to bring Dr. Liao in with open arms. 5-Star Orthodontics is helping sponsor the program. And I would, if your schedules are free, fly down to Dallas and spend 2 days with Dr. Liao. You won't regret it. I'll let him tell a little bit more about it in a moment. And that's not what this is for tonight. It's not an advertisement for that. We actually had this scheduled before the weekend next weekend. So it just kind of all worked out. So anyway, Dr. Liao, I will get off here and let you go. You're going to talk for about 70 minutes, 65, 70 minutes, and then we're going to leave a few minutes at the end for Q&A. So if you guys have questions, save them up, and Dr. Liao will be happy to answer them. So I'll turn it over to Dr. Liao.
Thank you. So if you have any questions, just type it into the chat box, or we'll catch up with them later, okay? So this one is about healing yourself. As dentists, we have an occupational hazard, okay? You also have felt it yourself. Bending over a patient for a living is a little challenging. If you have to double your gross production, you're going to hurt twice as much. So there's a smarter way to work. And that's what I'm here to share with you. And the interesting thing is that you are already licensed to treat yourself. But it's just nobody has shown you how. So tonight, we're going to go over some of these. This is Dr. Susan Kane. Most of the examples are doctors themselves. And I use these examples as to make a point. So here's Dr. Susan Kane on the left, pre-treatment, and 6 months later on the right. She had severe hip pain.
Dr. Liao, I can't see your screen. Am I the only one? Are y'all seeing Dr. Liao's screen?
No, I'm not.
I can't see it.
I'm glad you spoke up.
Oh,
there it is.
Now we see it.
There it is. Now we can see it.
All right. Thank you, Kathy.
You're welcome.
All right. So this is what's going to happen next weekend at Stewart Center. Today's topic is about dentist heal thyself first. All right. We used mouth airway sleep axis. This is a new term that I coined just in the last 3 months, actually. And we're gonna also introduce you painless clinical epigenetics. So consider this a fast bus tour. So you all feels like this at the end of the workday, right? Odds are, when you were a kid, nobody picked this up because this is the start of impaired mouth syndrome. Okay. And that's how you end up being susceptible to neck, shoulder, and back pain, given the occupational hazards. So here is Dr. Susan Kane. On the left is pre-treatment. Hello? Can I go on?
Yes, I think that everybody make sure your mic is muted so we don't get other sounds. I think that was just some ambient noise.
Okay. So here on the left, and on the right, it's the same person. What happened? Right. On the left, she has severe hip pain, poor sleep, and acid reflux. On the right, she doesn't look like she's hurting, right? So here's what happened. We gave her my version of epigenetic appliance. And so counterclockwise from top left, she became like this on the top right. And it's because we do this thing called 3D jaw diagnostic, okay? We target the solution to build into our appliances. So you have to know what you're treating. You cannot just push appliances and say, oh, use this brand, use that brand, use this lab or that lab. You have to know what's off where and by how much. And here we see that the vertical is overclosed. Okay, here we see that the width of the maxilla is too small for the mandible. That's going to be problematic for the rest of the body. Except dental school didn't teach us that. So I'll let Dr. Susan do the talking for you.
So I just want to tell you about this appliance because it's really been something spectacular for me right off the bat. I've always been the type of person that is super active, athletic, and a ballet dancer. But there came a point a couple of years ago where I started to really notice that I had a lot of pain in my left side, my back, that would shoot down my leg. And it started to, a lot of symptoms would come up where I was noticing I couldn't do a lot of the things that I enjoyed doing. I would be walking down the road with my dogs, and I literally had to stop on the side of the street and hit the floor in the middle of a walk. And I would just sit there in pain until it kind of resolved, stretched it out, and got back up again. I will tell you that I went to Dr. Liao's seminar because I was hoping that this could be an answer for me. So he delivers my appliance. My symptoms were like seriously diminished. I did not have pain. I could walk all through the square. I really wasn't sure what to make of it. But the next day I knew I was going to fly out of that airport again. And I thought, oh no, I'm going to be going to that airport. I wore the appliance with me through the airport. And when the escalator was too blocked, I felt strong enough to take my luggage and climb the stairs through that airport. And I couldn't believe it when I got to the top of the stairs that I had done what I had did, because I felt like that's how I used to be. That was me. That was how I have always been in my life, that I could climb any stairs I wanted to, dance through an airport. And here I was again, like, hello, I remember myself again. That's me. And I just felt like I needed to text Dr. Liao to tell him, you gave me back again. Like, finally, I can climb stairs again. And it was just a moment.
Okay, so it's enough for you to get the feel, okay, that this really has made a difference in her life. So one of the things we do not appreciate as dentists, not through any fault of your own or anyone, but except that dental school didn't teach us this because our professors was blind to this thing. they were in the dark ages, okay? So I took these pictures here on the right because she was squirming in her seat during my lecture. And I said, are you in pain? She said, yeah. So I gave her this, and 20 minutes later, she was not in pain anymore. Here is a summary of her symptoms on the left. There are 7 of them, okay? Pain, mobility, acid reflux, sugar cravings, pain, fatigue, and flexibility, okay? So on a 0 to 10 scale, after 9 months, she went from 70 to 11. The difference is 59. Divide 59 into 70 is 84% improvement, okay? So the mouth is a big deal to the whole body, and we just don't have any clue, okay? So it's my pleasure to share with you my favorite thing to do, which is my mini apple moment, okay? Newton discovered the apple falling downward and gravity through that, and guess what? This discovery eventually led to space travel, and I take great pleasure in discovering how big the mouth is for your patients and mine. So I came up with this term called MAS axis, okay? Mouth, airway, sleep. So a physiological mouth is one that is structurally fit and sensibly used to support whole body health through these functions: alignment, breathing, circulation, digestion, energy, and sleep. When these systems work, your body will thrive. When they don't, well, you're gonna be a herding puppy looking for doctors and therapists. So in the dental office, this is very often what it looks like. You got patients who are, trying their best and they're still hurt. You do your best and they still hurt. And one thing after another, and nobody's happy. Right? This is what impaired mouth syndrome does to both the doctors and the dentist. So we can say that impaired mouth disables the MAS axis. Well, because the mouth is at the start of this chain, why don't we fix the mouth? Okay. So let's look at teeth grinding, which is how I got started in this, okay? Symptoms common in bruxers. If you ask your bruxers, they don't just have teeth grinding. They have a bunch of other symptoms. Here are 8 of the most common ones that I've noticed. So ask yourself, how many of these do you have? All right. And the overlap between medical, dental, and mood is not surprising, as you'll find out later. So many of you know this case because this truly was a seminal case that taught me quite a bit. So I originally started reporting this as a teeth grinding case that was treated with Dr. Singh's appliance. But I kept looking at this face and I said, what happened to her in between? And is there something in this process that we can bring out so that we can apply it to everybody else? Because clearly she looks better, right? So this is actually a new frontier. It's called clinical epigenetics, okay? So CDC defines epigenetics as the study of how behavior and environment affects the way genes work, okay? And so we just need to focus on 2 things, and we can bring out a better version of somebody, okay? And those 2 things are what? Behavior and environment. So the way she came to me was, hey, I ground through my night guard here. Can you give me another one? I said, do you really want another one? What if I tell you that there's another way? If we can control this, we can get you to close your lips. You could have a better face. All right, notice that her lips are apart here. So I told her about Dr. Singh's work. I told her about and Dr. Singh remains my inspiration and guru, and I'm eternally indebted to him. And Dr. Singh in 2011 showed a severe OSA case whereby using this appliance was able to increase the airway volume by 58%. And that solved the OSA problem. Well, the patient went for it, and I did something else besides just using the appliance. I told the patient about eating healthier and organic, because she's a typical American teenager. And she's a tennis player. Her name is Riley. And we figure out, because I was trained in this thing, it's called Schwartz model analysis. We figure out that his maxilla is too small. So let's treat the maxilla. The maxilla is also retruded by -8 + 4, which is actually 12 millimeters. And then the mandible is -4 on top of -12. So you can see why she ended up with this airway and this facial profile. So we combine Dr. Singh's appliance with this face mask. And look what happened to her in 10 months. And over 2 years' time, we more than tripled her airway and more than double her minimal cross-sectional area. So here's 7.7, here's 24.1. Here's 120 minimal cross-sectional area, here's 276. Okay, so 276 divided by 120 is 2.3. So I like minimal cross-sectional area for a simple reason. That's where apnea happens. That's where the airway collapses. And I kept looking at this, okay, she looks better, but what happened, right? Okay, the airway did increase, all right? Not by 56%, but by 200%, all right? What happened, all right? It's because we didn't just rely on the appliance mechanics, okay? We triggered an epigenetic process where the genes got expressed. So when she went to the orthodontist, she was maybe 45% gene expressed. Here we could say maybe she come closer to 90%. I grant only God could give her 100%. But by making this difference, we basically changed her career. She got recruited to be a model partner. All right, so night guard is really an answer from the dark ages. Our professor didn't know, so we should not stick with what our professor taught us necessarily, okay? So one of my favorite quotes is from Dr. Richard Beisel, who taught me Succinic plus cephalometric. He says, you can't treat what you don't know, right? Your eye can only see what you know. So if you don't know, then you can't diagnose it. That's what diagnosis means, right? So we published this case and with Dr. Singh's help. And here's the important part, okay? Sleep bruxism is centrally regulated. That means it's not regulated in the mouth or in the jaws or in the TMJ, but it's in the brain. And then the highest risk factor associated with sleep bruxism is guess what? OSA. So translated, that means when patients grind their teeth, should you be thinking about night guard or should you be thinking about airway? Okay, to me, this is dark ages dentistry. This is the new paradigm. This is when the earth is flat. Okay, so this has implications on implant dentistry. If you do implants in your practice, when a tooth fails, you can give them an implant. What happens when the implant fails? Because you fail to understand why the tooth failed. How do you know when this is not gonna go? How do you know when the next tooth is not gonna crack? You don't. And so that's what happened in this case. I'd like you to just estimate how much this patient has put into her mouth. And yet the bridge fails here. That's when I got called in. All right. That's her airway. This kind of dentistry is being done every day across America as, you know, the standard of care. There's a study that shows that the implant failure rate is 13% among boxers. And this study used the same surgeon. He did 10,300 cases or something like that. And so we don't have operator variable so much. So same operator, 13% failure rate in boxers and 4.6% in non-boxers. So a hazard ratio of 3.3. All right, that means that you have 3 times the risk of failing an implant in the presence of proximity. What are you gonna do? You're gonna replace all these? I mean, my heart always sinks when I see this and this together. So I have one simple rule of thumb to suggest and share it with all of you to save you some grief. And we have the patients. Alignment, breathing, circulation before dentistry. Do ABC before D, please. That'll save a lot of sleepless nights and suffering and wasting money. All right, so this is what U.S. Surgeon General empowers us to do. It's not just teeth now, okay? It's a whole lot more than that. Here's a dentist, worked a whole career, victim of bicuspid extractions, perfectly clean teeth and gums. These are his symptoms. CPAP intolerance, daytime sleepiness, bruxing, TMJ issues, asthma, allergies since grade school, low back pain, AFib, sugar addiction. We have the 33% airway. What's missing in our dental training? Because dentists are not airway mouth doctors, the patient end up with this one day, okay? Why? Because they're forcing pressurized air passes. Now, don't get me wrong, I'm not against CPAP. I think CPAP could be a good rescue device. But for myself, I don't really want to know, what can I do to be proactive and keep myself from needing this, right? We don't want to lose teeth, so we have to do a certain prevention behavior. But how about how to prevent this? Well, it turns out that this is strictly in the dentist's wheelhouse, except nobody ever trained us to do that. So again, Dr. Singh did the research. He said in OSA patients, the maximum mandible are 7 to 10% narrow. Oh yeah, then why don't we just grow the jaws? This is what epigenetics can do now. All right, so not only do we have an alternative, we have a preference, and we have a physiological basis for doing this. No less than the U.S. Surgeon General says we should be doing this. Okay? So high blood pressure, cardiovascular disease, stroke, diabetes, obesity, all of these are related to OSA. Lower immunity, depression, anxiety, brain fog, senile memory, chronic pain. All right, it all starts from hypoxia, and hypoxia starts from impaired mouth, airway, sleep, access. So I've designed my own appliance. Think of it as a Gen Next smartphone, if you will. And it is an orthopedic device for redeveloping and realigning the jaws to reduce pain, teeth grinding, TMJ dysfunction, snoring, upper airway resistance. Notice that I didn't claim sleep apnea there. Okay, I think sleep apnea should be a medical doctor's issue to deal with. You really do not want to be dealing with someone who's 400 pounds and their hormones are out of balance. You want to be dealing with things that are easy, predictably successful. So there are no axial springs here. There's a parking groove here for the lower incisor to land in, and so that would decompress the TMJ and open up the airway. And we complement the appliance with nutrition, bone building nutrition. The best of the plant kingdom with green smoothies, and the best of the animal kingdom with bone broth. People ask me, well, what do you put in there all the time? I said, well, whatever I have in the fridge. Whenever I go to the supermarket, I look for things that I can put in my blender. Okay. So here's half an avocado, here's 1 peach and 2 blueberries, and underneath that, it's a bed of arugula and carrots and celery. That's it. And this thing is good for your blood sugar. All right. So a lot of fiber, a lot of vitamins and bioflavonoids. That in combination with the bone broth is a precursor for collagen. So when you have structurally impaired mouth, you will have pain, you will have fatigue, you will have hypoxia, and a whole host of medical, dental, and mood problems. So here's an example, because I know what's on your mind. So let's go through a case in some detail. All right, everybody's got a dental office full of patients like this. It's just that we need to connect these dots for them. Right? This is where she hurts. And she has tried Thai massage, yoga, chiropractics. She's been to dentists, she's been to medical doctors. Nobody ever looked at her this way. Okay. So this is 3D jaw diagnostics. This is the transverse dimension. And so we can see that the maxilla is too small for the mandible. And this has whole body consequences, like what you saw. All right. We actually do our homework and try to figure out, okay, which arch do we need to treat? Is it the maxilla, the mandible, or both? Because most of the time, it's the maxilla that's the problem. Okay, so if this airway is this small, where did it come from? What do we need to treat? And this is what 3D jaw diagnostics does. It tells us what's off where and by how much. So that if you treat that, this will predictably get better. So here's what the appliance looks like in the mouth. Here's a parking spot. The mandible is very happy to be there. And the TMJ, their back pain gets better. And so the appliance starts out with the edges touching, and we're done. You know, the edges are wide apart. You all know this already. So we took it from here on the top left, counterclockwise to here. So a lot of people say, well, geez, you can't do this. You're just tipping the teeth out buffalo. Well, I'll let your eyes do the evaluating yourself. Okay, and now we'll compare the pre-treatment and post-treatment CT. And so we have a 66% gain in the airway volume and a 43% gain in minimal area. There's a change in the machine. My old CT died, and the new one just doesn't have the same software configuration. Take it from me that she said it's wonderful to have that machine. She actually got a new career. She's a special ed teacher, and now at night she's also a yoga and Pilates teacher. So she has so much energy, she decided to just open another revenue stream. All right. So I always ask my patient to say, okay, rate your symptoms. If pre-treatment was 10, 0 is nothing. Where are you now? You went from 50. Okay, shoulder pain, daytime sleepiness, jaw clenching, jaw popping, and crooked teeth. 50. 38 months later, 5. That means she improved 45%. That's a 90% gain. No drugs, no shots, no pain, no drug. Patient loves this kind of treatment. If they don't have to go through what they know as going to the dentist. And I want to show you what happened to her neck. All right, despite going to the chiropractor, she had this. Despite going Thai massage, she had this neck. When we got done, her neck self-aligned. Okay, this is what her arch looked like. And so look at this. This is phase 2 now. We're into clear tray finishing. Midline's on, buckle over jet, and all the posterior teeth are upright. Okay, so impaired mouth will disable your whole body health through the MAS axis. Why don't we enable it? So here comes the next case. This is a 34-year-old man who's starting a new business. Counterclockwise from top left, we went from here to here to here to here in about 28, 30 months. Again, do you see any buccal tipping? And here's the model analysis. We widen his palate from -6 to +2 for a gain of 8. From -1 to +5 for a gain of 6. And the same with the mandible. All right. So now we have a maxilla that's wide enough for the mandible to fit in. Now that means that there's no retreat. So we made the airway analysis, and his airway volume gained, I believe, 60-some%. Okay. So the result is that all these symptoms went away. 90% in 30 months. Okay. Witness apnea. He used to wake up gasping for air. Spastic. Teeth grinding. Use niger. Okay. Notice this. Witness apnea by wife, 10-0. Teeth grinding, 10-1. Teeth crowding and chipped teeth, 10-0. It's tremendous improvement, all without drugs, without shots, no pain, no surgery, and this will hold because you treated the root cause. The root cause is what? Airway obstruction. Despite looking like he's here, his symptoms tells you what? That they're not enough. All right. So how do you know what to treat? Well, you need to know the 3D jaw diagnostics. So this is new to dentists and medical doctors worldwide, except for the few of us who are in this realm and in touch with Dr. Singh's work. Here's another dentist from Canada. He went from left to right in 12 months. With severe TMJ. She said, I'm living impaired mouth syndrome right now. Okay. And I had severe chronic TMD. Look, you're a dentist, right? Didn't the dental school teach you anything? The answer was no. Done lots of chiropractic work, acupuncture, massage, even trigger point injections. Never mind being a dentist. So we gave her this treatment that I've described to you already. And she improved 80% in 10 weeks. Again, no shots, no drugs. Right hip clicking went from 6 to 0. All right, sleep quality, 8-1. Daytime sleepiness, 8-1. You pick any one of them. They all improve across the board. This is how big the mouth is. So we need to make a distinction. Patient says, well, how come my other dentist didn't tell me this? Well, I told him I had to hack my way out of the jungle myself. Thanks to Dr. Singh and thanks to patients like Riley Hart, the tennis player, the first case. So, dental school trained us to fix teeth. Well, we need a different class of mouth doctors to treat impaired mouth, airway, and sleep access. Okay, because they will lead to pain, fatigue, and all these symptoms are in blue. You ever have hostile patients who are rude to your front desk? They need help. Okay, but it's not dental work they need. They need oxygen to their brain to improve their mood. Here's a medical doctor. She had severe acid reflux, so she went and bought herself a new set of teeth. And after that, she still had that pain. After that, she got talked into getting jaw surgery. She said, well, I got a nicer profile, but I still have all of these. That's when she read 6 Foot Tiger, 3 Foot Cage and reached out to me. Well, we got her a 70% improvement in 4 months. Everything across the board again went down pretty dramatically. Okay. Back pain 8 to 1. Well, from a mouthpiece, yes. Predictably, consistently, yes. So we can say that impaired mouth is responsible for 70 to 90% of all the health issues that patients go to the doctor for. And in fact, you can think of impaired mouth as disrupting health, whole body health is polio. Except polio, people can see it, they can give you sympathy. You got an impaired mouth, you won't get any sympathy, trust me. I got lots of patients who told me that. Okay? So now the road forks, right? The old paradigm is night guards, mandibular advancement devices, everything but hitting the nail on the head. And now we have a new path called epigenetics to turn on the best face and top out. I will tell you that taking this epigenetic path to treat the impaired mouth syndrome has resulted in improvements of all these conditions. That's based on my patient's report. That's not based on my own claims. And every one of these, I have patients' testimonials, I have documentation to back it up. So then my question is, well, how come we have to wait until these show up to treat it? Why can't we get it right the first time when the kids are growing, right? How about if we enable this mouth airway sleep access on kids? Well, along came my granddaughter, Camilla. Okay. And using the same principles, this is what she looks like now. You don't need an appliance. Okay. So humans are designed to blossom without appliances. We need appliances only to make up for what went wrong, or what got overlooked, what got missed in checkups. All right. When you only look at teeth, you forget the whole person. When you look at trees, you miss the whole forest, you miss the whole terrain. So the bone building diet is good for growing the maxilla. It's good for treating snoring, sleep apnea, nasal issues. You raise beautiful children, beautiful hair, skin, gut lining, facial radiance. All right, never mind the systemic benefits. This is the turkey soup that you take out of the fridge the day after Thanksgiving. So this is what a well-developed mouth should look like. Room for all the teeth to line up straight. Okay. So that belongs to the daughter of a dentist who trained with me, and she was a naturopath in the Philippines. And so her daughter had very good care growing up. The mom is also a homeschool teacher for the daughter. And this is what her baseline looks like. And the symptoms baseline was wake up tired and unrested. After she started braces, she had headaches, focus on schoolwork, because mom's homeschool teacher noticed, and singing voice is strained and loud snoring. Okay. Now this is a naturopath daughter. We did our homework, figure out what needs to be treated, gave her this appliance. Look what happened from here to here, and from here to here in about 10 months. Okay. Fast forward 2 years, you look like this. So this is about genetic unfolding using an epigenetic appliance and bone building diet. No braces today. We're not all done yet because there's still some growth to be achieved here. This was probably earlier in January this year. But look what happened in 2 years' time. In the process, we just about double her minimal cross-sectional area, and we gained 50% in her airway. So what did that do for her symptoms? Well, just like the pattern you saw. Sleep disruption went from 8 to 1. Okay, snoring 8 to 2, headaches 9 to 0. Inability to focus 10 to 4. She's a teenager. Vocal stress 9 to 2, fatigue 10 to 2. So again, we gained 80%. You can see that number is somewhere between 70 to 90%. The center on 80 all the time. So she became the national champion in speech and debate among all the kids who are homeschooled. Look at the number of medals she won. Okay. So what do parents want to buy from? What do patients want to buy from? We might ask, okay? This is really the thing to do, okay? It's not the trinkets. It's not this omelet. It's not this veneer. It's not this straight white teeth. It's the functional capability that gives them the best life possible. And think big and dream big to even deliver it. Okay? I would say that to enjoy health and life with abundant energy, great sleep, and it all starts with the best maxilla you can give them. Okay, and best of all, you can do this without having to bend over a patient for a living. This is my equipment. This is my setup. I just need a Dremel tool and a dent airbag. All right. Patients love it because all the drilling takes place outside their mouth. So how do we get it right the first time? Well, we need to know what we want to treat. Okay, so is this too many teeth? We don't have time to discuss bicuspid extraction here. Boy, do I have something to say about it. This is, when you just look at this, you know that the jaw didn't grow enough. Okay, why? Because to me, this is one of the most important landmark studies. Pediatric obstructive sleep apnea, none of these children is a disorder of oral facial growth. It came out of Stanford Sleep Center, the premier research center of sleep medicine. So, given this, we can ask a question, right? Who's in charge of oral facial growth in healthcare? Well, I submit to you that clinical epigenetics is where it's at. Okay. So I just published this review article documenting various cases so that orthodontics will not keep on doing the dark ages way. Some of you may do orthodontics If you want a reprint of this, just reach out to me. I'm happy to share that. I have many more cases to go, but in the interest of time, let's see how I'm doing. Hey, I guess I'm still doing okay, right? Good. Thank you. All right. So red flags for your kid's best face, just have the parents fill this out on your kids. One of my students started 51 cases in 2 months. She has a very good relationship with Holistic Moms Network in her community. This is Dr. Maria Dwyer in Montana. For adults, we have one where on the left side, it lists all the frequent symptoms of malnutrition and bruxing. And the right side, it's the medical side where it's the OSA symptoms and metabolic syndrome and hypoxia symptoms. Every dental office has got a patient base that will basically help you open a second practice. That's Airway oriented. The problem is always the 3-foot cage. Jaws that fail to grow during the developmental years, but nobody paid any attention to because we were trained to just see cavities and gum disease and diamond drills and whatever, except the whole patient. All right, so when you see crowded lower front teeth, you can bet that the maxilla didn't grow in. When you see bruxy, you can bet there's airway part. So look at all these things here, just these, okay? And tell me how many patients, what percentage of your patients have these issues? Never mind the medical side. I would tell you that somewhere between 80–90% of your patients need this help. So we did our homework and we figured out that a dentist, see 128 patients a month, and another one is a hygienist. Long story short, in 1 month time, if you make the diagnosis and do the airway records at $800 per case, you got $11,000 waiting for you to actualize. And so there's a potential revenue stream here in this diagnosis here. Now, we don't fake these things because this is Dr. Jeff Yelly, and he got 52 cases right after when she finished training. The diagnostic records, 52, half of them started. Okay, and so the total income was 186. It's actually higher than that now, but go with the old figures because the return on investment is 10x. You made $184,000 from paying it. That's 10x. But the more remarkable part is this: you got 50 diagnostic cases, 52, and then you got half of them started treatment. That's remarkable. If your patients are literally turning blue, waiting for you to rescue them. And Dr. Yali himself says, you can quote me, by far the highest ROI I've seen implementing advanced dentistry in my practice. And the smart thing is he delegates all of that to his airway treatment coordinator with him. And so he just carry on his work, and Brittany does all the airway side of the diagnostic records and educating the patients. All he does is come in and take the construction by and deliver the appliance and say, see Brittany. All right, so AMDs are starting to learn that these patients are everywhere. And without you showing up as AMDs, These patients never get better, right? So this is a husband and wife team, and between the two of them, they got 8 cases already, okay? 8 cases already. This is in 1 month. You can help patients like this now, okay? Just because their teeth look fine doesn't mean they're fine. They are hurting puppies. If you know how to ask. They are hurting puppies if you know what to look for. Look at this. What did I say about crowded lower front teeth? The maxilla is underdeveloped. When that happens, you got an airway, you got a pain problem. Okay? So they're learning how to do this on their own. We have a mentoring program for dentists to opt in. You can do it yourself, totally okay, or you could be mentored. But the best thing you can do for most efficient thing is bring your whole team to get trained. This is Dr. Doris Flores right here. He brought his entire team to Tyson, Virginia. And this is the result she's getting, okay?
So we start. Hi, I'm Josie Sutton, and I'm a patient of Dr. Ferris, and I am allowing her to use this video for educational purposes. And I just want to say it's been 10 days since I've had the appliances, and the biggest thing for me is not waking up with terrible TMG and not starting the day with a headache. I've dreamt for the first time in many years, and it's only been 10 days. So already I feel so much better. From the very first day, it seemed to have moved my jaw somewhat forward, and it's been really great. So thank you.
Thank you, Josie.
This is fun work, okay? So this is Dr. Susan Kane's patient, and this is her case, okay? She only sees patients 2 days a week. This is 12 now. Okay, so she only sees patients 2 days a month, 2 days a month, 2 Saturdays per month for Airway cases. Okay? And she started 12 cases in 10 months. I did the math. It's 8.7x. Okay, so Dr. Yelly was 10, she's 8.7. Imagine if she was to work full time, she would have a 64x return on investment. Okay. So the mentoring is sort of like an in-office residency. You get your question answered, you get your problem solved, you make your patient. So here's our text exchange. All right, I got significant scoliosis. Now the new appliance come and I now have pain. So Dr. Kane says, what do I do now? Well, here's my answer, right? So it's normal and healthy to have healing hiccups, okay? Because all the old adhesions are being broken up and needs to be flushed out. So I recommend yada, 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 okay? So problem solved and everybody moves on happy. I'll let the patient do that.
Video. Okay, now we go.
You hear it again.
Oh my God, is it only the right side?
So there's a little crack on this side, but
Uh-huh.
definitely not like.
Okay. So now we'll go to the next one. This is the same patient after starting treatment.
Okay, this is fair.
Hi.
How long have you been wearing your appliance?
I've been wearing it for about a month now.
Okay, let's see how it
Okay,
looks.
just 1
Take a
month.
smile. And she was concerned that her jaw was being pushed into a weird position. However, I explained that her jaw is actually straight now, even though before it was slanted, and she always had. Explain what your symptom was before.
So the major one was TMJ popping and cracking. Now when I open my jaw, it doesn't make a sound at all. That's weird. That's really weird to not hear that big old crack. But
It was
yeah.
a lot. And did you
Forget
used
that.
to always have like What other symptoms, like headaches?
Yeah. I feel like I would be a lot more sleepier throughout the day. I'd wake up with migraines. I'm definitely clenching and grinding a little bit less just because that whole jaw pain that I used to wake up with is I don't really feel that anymore.
Amazing.
Yeah. So little by little, it's like changing everything.
Okay.
So it's not just Felix, okay? It's the principle. Chiropractors need our help, okay? This is Dr. Rosemars because he did the 3D jaw diagnostic work. And here's the problem. The maxilla is too small for the mandible. This chiropractor has been going to the dentist all his life and nobody ever picked it up until he met Dr. Rosemars. And so we do our homework, and now we can explain why he has these symptoms. Look, he's a chiropractor. He can't get rid of his low back pain. Right? He has neck limitation. Why? Because he's got an anterior open body. As a result of what? Tongue struggle. As a result of maxilla being too small. Now we know what we're doing. Right? So let me bring this to a close by coming back to dentists who can help themselves this way. This is a set of gorgeous teeth, right? But the owner is negative. She's got pain. Yeah. And her problem got solved because her senior associate employer dentist was in my class, saw the slide. It basically says hypothyroidism matters. This is a hypothyroid tongue. So she went back and looked at her junior associate's mouth and gave her this appliance. And guess what? She went from miscarriage to being a new mom because her airway opened up 2.3x in volume. Okay, a minimal cross-sectional area 2.7x. Okay, so she became a mom, and this is what fulfillment in dentistry looks like to me. Okay? So let's look at her symptom progress. Okay, she get 83% gain in her airway in 6 months. And look at her pain, fatigue, shortness of breath, brain fog. Okay, everything went from 10 to 2, 10 to 2, 10 to 0, 10 to 2. Total improvement, again, 80%. Now, I want to talk a little bit about adrenal exhaustion because we're very whole health oriented. We don't just use an appliance. We're not just mechanics. We are serious airway malpractitioners. Okay? So we're the diagnostician and we are the play caller. Okay. What else the patient needs in order to become a functional whole? Spotlessly clean teeth. They're being killed by bruxing. Okay. Why? Because her airways is deficient. Right? And she had already lost 2 teeth. All right. She, on her first day, she held onto my arm and said, "Please keep me from losing another tooth." When you go to sleep with a choked airway like this, you are confronting death every night. So this photograph was taken by the wildlife photographer of the year for London Natural History Museum in 2019. This is right after hibernation is over. This marmot come out of its hole. Whoops, there's the fox ready for lunch. And you can hear it screaming. In the mouth, in the hand, throughout the body. Oh my God, I'm dying. This is what happens when patients with airway obstruction go to sleep. This is what happens when patients grind their teeth. Right? So if you do that night after night, you are gonna go down the hill. This is one foot in the coffin. This is where I say you would rather have your medical doctor handle the morbid cases. I'd rather work here than here. Now, I've handled these patients, but you have to know what you're doing. The problem is if you're tired and exhausted, okay, how are you going to come back up the hill with an empty tank? I'm found of this story. This is written by Dr. Jerry Tennant. It's called Healing is Voltage. What's voltage? Energy. Okay. What's thyroid? Energy. What's adrenal? Energy. He says, your body is like this carriage. It's pulled by two horses. One is called thyroid, the other one's called adrenals. Usually the thyroid goes first, and then the adrenal has to do double work. And then before you know it, adrenal is shot, and now your wagon isn't going anywhere. Okay? So when your adrenal is shot, the patient cannot come back. So that applies to dentists and your patients. Right? We have corroboration that the mouth is on top of the totem pole. Right? Breathing and eating are the most important survival reflexes. Nitric oxide. When you're 20 years old, you got 100% of it. You live a healthy lifestyle, you'll have 80% of it at age 50. When you eat a standard American trash diet, you'll have 10% of it. Okay. So what? You say, well, this has to do with whether you get nasal breathing and get your lungs opened up. This has to do with whether or not you have nasal obstruction, you have to snore. And by the time you get, as a man, refer for sleep test, guess what? 2/3 of them already have erectile dysfunction. So here's one of my patients who had ED as part of his presenting complaint. And after this treatment, we pretty much solved the problem for him. And he basically says, look, they're advertising the wrong things during football. In the interest of time, I won't play it because I still got probably 20 slides in 10 minutes. All right, so we will introduce to you a bunch of resources for improving your whole body health. For example, this product, I did a little experiment on myself. I woke up and I did a reading on my blood pressure and pulse. I want you to look at how the diastole went down. All right, so every 30 minutes, every 15 minutes, I took some of that and look what happened. I went from 81 diastole on waking up to 60. This thing has a way to relax your vascular system like no other. Okay, so you can do that to augment yourself. And you can widen your own airway now, regardless of age, as long as you have healthy teeth. It's my own case. I went from an airway that was in trouble to an airway that's not. And now every night when I go to sleep, I say, thank God for Dr. Singh's work. You have been licensed already to do this work. So start with impaired mouth diagnosis, start making the difference. And the care of the human frame and diet in the cause and prevention of disease. A bigger drill, a larger, longer implant screw is not where it's at. That's not physiology. That's compensation. This patient on the left was pre-treatment, on the right is post-treatment. In between, she had a baby. You're not supposed to look better after you have a baby, but she did. This patient on the left is pre-treatment, on the right is also after she had a baby. We didn't do any braces either. You don't need it. He's a lawyer in the mid-50s. And so what, you said? Well, she looked like this in profile. She got so confident that she got a divorce, and now she's enjoying dating. This is incredible career fulfillment. And you can treat kids, no braces. You get them straight by straightening the maxilla. We have Brittany McGough, who can be your personal guide if you want to contact her. She worked for Dr. Yelly, and she can tell you firsthand how to start your practice correctly, what the secret to success is, and she can go to your office and get your staff trained. All you do is make an appointment. So I want to conclude by saying that clinical epigenetics is now real. Dr. Singh is academic epigenetics, greatly appreciate the research. But what I do is I translate it into the wet finger practice. No drill, no shots, no pain. The patients just do these steps and they can redevelop their jaws. And so we'll offer part 1 of this 4-part training series at the Stewart Center. I can't promise that BCD will be there, but at least you should consider taking this to get started there, because Al was very kind and Kathy's help can make that happen. So with that, I'm going to say thank you. This is my website. If you want more information, this is how to get in touch with me. So, Kathy, how did I do?
You did great. That was a lot of information. Wonderful.
Well, like I said, it's a bus tour. But we're happy to open it up for any questions you might have. Anybody?
Yes.
Nobody? We can go home now?
I have a question.
Yeah, sure.
How great is it to hear you talk about all this again, Dr. Liao? I want to say that anyone who's a bit interested in this, this would be a great track. I did this starting in 2017 or 18, and it was wonderful. I think Kristen could speak up, but she was right before me. She started with you before I did. But my question is related to success rates, and sometimes I don't get the success with expansion that I would like, and I wonder if it is one of two things. Is it the patient's diet, or is it not using a reverse pull face mask?
Okay, so very good question. I'm really proud that you are applying yourself in order to come up with that question. It's very clear that you're a thinking doctor. So the answer is that this is a whole health approach. So we don't have time to go into this thing, but for example, I insist on nasal breathing. All right, if you don't have nasal breathing, you don't have lip seal, you don't have a start. So there is a reason why nasal breathing is zone 1, because that's where the air enters the nose. All right, let me look for that slide here. I see somebody ask me about, do I use myofunctional therapy? Yes. The first case that I did, the Riley Hart's, listen here. This is myofunctional therapy, okay? So I'm sorry I glossed over that, but no question, that is an integral part of this. We didn't have time to go into the 4 original sins of impairment that led to the impairment. So one of them is tongue-tied, the other one is nasal obstruction. You eat a standard American diet, you're gonna have nasal obstruction, right? There's one slide I'm looking for. Let me just scroll real fast so you can see I prepare a lot of, here we go. Okay, So air enters the nose, it gets warm, filtered, humidified, and the viruses gets killed here before it goes behind the soft palate, and then behind the tongue before it goes in the trachea. So this part here must work for there to be a lip seal. If you don't have a lip seal, you don't have any results. All right, so that's why I insist on the bone building diet. And if they don't do it, I would know what to look for when they come back. That is, they will have gaps in between their teeth. Because they're relying on the mechanical expansion and they're not supplying the body with bone building ingredients. All right. So wear time, diet. And when you clean up the diet, by the way, you will also clean up your nasal obstruction. It's that simple. I had that slide here that says bone building diet supports this, and this. I think I know where it is. Hold on. Right here. Okay. Snoring, mouth breathing is in there. Okay. This is rich in gelatin. Okay. That's why it's a jello. Okay. This is rich in bone building precursor. Right. So when they do this, they'll also clean up their vascular system, they'll clean up their GI system and all of that. So did I answer your question?
Yes, and then what Sassoon results do you look for to know when to add that reverse pull face mask?
So when the maxilla is retruded behind the anterior reference line.
Okay.
Yeah. So in this case here, this is -6. That means the maxilla is retruded. That means it needs a little stimulus to come forward.
Okay.
Good. You look great, by the way. High compliments, Kelly. I'm impressed. You all sent me a selfie. Truly.
See.
You age younger. Yeah, since I saw you last. Anyone else?
Felix, I have a question. This is Hal.
Sure.
What do you do with you know, like when you see a you know, 7 or 8 year old child? Are you that's definitely behind in their maxillary growth?
Now.
How do you handle kids that young?
Yeah. Here, let me unshare this. So I want to just, leave an impression here. Disorder oral facial growth. That means what? Mothers need education and support on what to feed their kids. Okay. I feel bad for the mothers who have to work full time, put up 20 meals a week, every week. Okay. And get the kids to school on time and pick them up on time. Let me see if I can find another slide deck here for you. So first you give them that little booklet called Your Child's Best Face and see if they are interested in moving in that direction. Because without, if you eat pizza and ice cream and bagels and cold cereals, you are never going to grow the best face. So you want to establish the parents' motivation and interest. If they really want to go, they definitely can. So let's see here. I just gave a talk. Oh, and also you need to stop mouth breathing. And so bone building, that is one. But another one is called food inflammation test. This is about food sensitivities. And food sensitivities requires that you address this issue. Let me just show this here. It requires that you know what food to avoid. So we often see this. In fact, I know how to look for this even without a CT scan. Here, let me play this for you.
Can you just breathe through your nose for me?
Here's a battlefield test.
Good. Now block one nostril like you did earlier. Inhale strongly. Good. Thank you. Thinking the other way, please.
You're listening for obstruction.
Good.
You're
Now
looking
let
for
go.
collapse here.
And I want you to snort very quickly, like this. Again. Harder. Thank you.
Yeah.
All right.
No,
Yeah. So you got to make sure this part works, and the way you make sure that works is that you have to talk to the parents a lot about their environmental factors. Remember when we talked about the epigenetics? You got to change two things: environment and behavior. Behavior is how you use your mouth, how you own and operate your mouth. The environment is what? Here's a filter for this over-the-counter unit. Okay. Here's a new filter. Here's what happens after 6 months. When you go out to eat, this is what you're getting. If they're sure as hell not going to use this. This is a pile of snow in a pristine Washington, D.C. suburb 1 week after the snow fell. This should be snow white. This is automobile exhaust. Okay. This is the reason why all the nasal obstruction. So you necessarily have to become environmentalists. We have, fast foods with antibiotics in the beef. You're basically gonna have to become a wellness resource all over the mothers. They're gonna look at this and go, huh? Yeah, well, it's time to wake up, ladies and gentlemen. It's only a part of what we talked about. This is the real slide I was looking for. Epigenetic essentials to grow airway and breast space. Okay. The absence of 4 original things: tongue tie, nasal obstruction, hypothyroidism, and gut inflammation, and toxic chemicals and pollutants. And then the presence of physiological norms: lip seal, swallow without grimace or gurgle. This is myofunctional therapy and tongue tie. Okay. But you can't have that unless you can breathe through your nose. And then fresh home cooking. I make my own granola. All right, I make my own green smoothies. If I want the health benefits, well, I have to be willing to work for it. Okay, the appliance is just an assist. This is the magic right here, A and B. Appliance is just an assist. Appliance is a compensation. All right. And if you do an appliance that you don't design with 3D drug diagnostics, well, good luck. I mean, I don't say it won't work, but I'm saying you need to know what you're treating. That's all. I hope that helps. Did I answer your question, Hal?
yes, you did.
Okay.
Makes
Good.
perfect sense.
Okay. Anyone else with any other questions? But tongue tie, lip seal, swallow without grimace or gurgle, these are all myofunctional therapy issues. So, yes. Yes, and biological dentistry. Yeah, thank you, Dr. Oshie. So, biological dentistry basically is about how teeth affect whole body health and how toxic filling materials affect whole body health, how hidden infections affect whole body health. There's one assumption in this whole thing, and I'm sorry I didn't bring this out at the very beginning. That is, you need sound natural teeth, free of infections, free of toxins, all right? But most dentists have done a good job saving patients' teeth. Now let's put those teeth to good use. The good teeth, the good use will be, okay, use those use those sound teeth to start making this kind of difference. Because you need the stem cells from from the PDL and all those teeth in order to make this kind of difference. You have no teeth, I can't help you. Sorry. All right. Anyone else? Okay, well, if you're interested, you know, certainly we welcome you to join us next weekend at the Stewart Center for this event. Let me just put this up again. Like that. Just call Kathy or reach out to Kathy or reach out to Kathy.
Dr.
Yes.
Liao, thank you. Thank you so much. You know, we're just like you said earlier, I've been practicing dentistry for 30 something years. And for the first time, the last 5 years, we've evolved into a practice that looks at the teeth. The teeth are the very last thing that we look at. They're just victims. They're victims. we need, yeah, we need to address them, but we want to just change our whole mindset on this. And what we've been teaching the last 10 years at the Stewart Center it's very viable, because you do have to address the teeth at some point. But what I want our doctors to do is start looking at more than just the joint and the bite, because there's a lot more that comes before that.
Yes. Well done, and high compliments, Dr. Howell, and all your members. You are definitely in the top 5% in terms of evolution among dentists out of the dark ages. And this is the next step up. Agreed, 100%. Okay. Kathy, you have anything parting words?
Well, I just want to remind everyone to look for that email. We've been sending them about twice a week on the upcoming a 2-day event. And if you have any questions, call me. But that link on that email goes right to the registration page for Dr. Liao's organization. And also, too, I will send out an update tomorrow, but we finalized almost all of our upcoming study clubs. And on November 15th, we will have Judson Wall, Dr. Judson Wall. Hal, you want to say anything about him, or Dr. Oshie?
Well, I think Dr. Oshie can address that better than I. She knows him better. We're going to talk about prolotherapy, or he's going to talk about prolotherapy. Yes. Dr. Oshie, do you have anything?
Oh, she might.
Hi, everybody. Sorry. Dr. Liao knows him too really well.
I just want to say, if I may jump in,
yes.
Dr. Wall is one of the smartest, one of the most gifted biological dentists there is. If you touch teeth, you need to listen to him. Okay. If you're in the mouth, you need to listen to me. Sorry. That's just how it goes. Yeah.
Thank you. But that's next, that's November. I'll send something out on it to you every week. I'll send more than you want to hear.
All right. May I just say a thing about this? If you are suffering from impaired mouth syndrome yourself, we designed this thing in a way so that you can just show up for $1,500. If you decide after the 2-day weekend you want to sign up for the training, $1,000 of that will go back to you. So you have basically nothing to lose, and you will get your construction bite from me personally, so that we can get your plans made. You'll learn to engage the patients. You'll learn to document cases such as what I've shown you. And we will need, before you can get your appliance from 5-star, we will need you to get these 4 items: your dental models, whether it's printed or scanned, it doesn't matter. Or poured. We need your Sassoon tracing from your lateral ceph, We need a standard orthodontic cosmetic photos. We need your CBCT images of your airway, your cervical spine, and TMJ, and so on. Okay. Then I can design your appliance. Then you can get your start driving appliance and for delivery for Part B. So that's how this thing works. And definitely bring your team, because when you bring your team, you'll go back to the office Monday morning with tailwind. If you don't, you'll have headwind. Voice of experience.
And also there is the team members that are not the dentist, but team members and staff auxiliary are 600 each is what
No,
the need.
200.
How much?
200.
Oh, whoa. Okay.
Just 200. Yeah.
Okay, great.
Yeah.
That's even better.
Yeah. We want to encourage this thing.
Yes. Okay, good deal.
Okay. All right.
Thank
Anyone
you,
else?
Dr. Liao.
You're welcome.
Dr. Liao, thank you so much.
Be my pleasure.
Thanks,
Thank you.
everyone.
Take
Good to
care.
see everybody. Bye, Dr. Liao. Bye, Hal. Kathy.
Bye.
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 See you later.